non-gynecological lecture, and I'm sure a couple of things will carry from here. We always say these days, Ek Bharat, Shresh Bharat. And the philosophy behind the New India is, it is amazing what you can accomplish if you do not care who gets the credit. You have to see that particular thing. The selflessly, if you have to do work, then I think things are going to be great. Now we all know that sleep is a biological necessity. It's not a luxury. And today in modern pace of life, there's hardly any time when we can say that I'm going to stop and rest. And to have a wonderful, regular night's sleep is a dream which is an elusive dream. And so I'm going to touch upon today the importance of health, importance of sleep, because it is one of the three fundamentals of health: diet, exercise, and sleep. And not only this small child is there on one side, there's a middle-aged person, 30 years is also there. What is the person's name? And you can see a person of 70 years round. You find this kind of pictures are not uncommon. Again, this is the kind of pictures are not uncommon. And at workplace also you find many times people are snoring, not only sleeping, not only having a nap. So, sleep is a biological necessity, and our elders and experts say that neurological degenerative disorders have great connection with good sleep and circadian rhythm. In today's time, our youngsters have forgotten the night is meant for sleeping and the daytime is for work. Now, I think each one of you should be very clear what is circadian rhythm. The physical, mental, behavioral changing that occurs in most humans over 24 hours cycle primarily are regulated by light and the darkness of the surroundings. It is distinct from biological clock, but two are related to each other. The biological clock controls the circadian rhythm and the related processes of the body. Now this is circadian rhythm. You can see 12 o'clock noon and 12 midnight. So, if you find that 2 o'clock night, 2 a.m., your sleep is the most sound. As doctors, we have always realized, अगर आपकी 12 से 4 बजे की नींद पूरी हो जाए, तो आपकी पूरी नींद हो गई. This is what we used to say. कि 12 से 4 की नींद बहुत important है, and that particular time you can see at 2 o'clock the sleep is definitely deepest. And then at morning times you can find that your temperature around 4:30 is the lowest temperature. At 6 o'clock, because the body started making movements, the cortisol is released here, you can find sharpest blood pressure rises there. And then melatonin is a stop as far as the secretion is concerned. Then you find around 10 o'clock, it is highest alertness is noted, same as at 12 noon, and by 2:30 you can find the best coordination is seen, and by 5:30 it is fastest reaction time is there. You can find the best muscle strength and your efficiency is cardiovascular efficiency is seen around 5 o'clock. The 6 o'clock is the highest blood pressure when you come back home, and the highest body temperature is found at 7 o'clock. And then melatonin secretion starts somewhere around 9 o'clock. Now this makes it more simplified. You can see the midnight, 2 o'clock is a deep sleep, lowest body temperature is noted at 4:30, the cortisol release at 6 o'clock, and there is a rise of blood pressure. The fastest increase in blood pressure is noted. You can find the alertness around 10 o'clock, and the best coordination around 2:30, fastest reaction time before 5 o'clock, highest blood pressure is seen around 6 o'clock, and melatonin secretion starts around 7 o'clock. Now, when you have inadequate sleep can cause the problem of obesity and thereby related non-communicable diseases. I told last time also that whenever there is a lack of sleep, there can be risk of depression, anxiety, and stress is there. If the sleep is less, there is a great incidence of joint pain, risk of irritable bowel syndrome is also, and bowel disorders is also noted without good sleep. Your risk of infection increases. The problem of if there is inadequate sleep, these are the people who get into dementia, Parkinsonisms, and the risk of Alzheimer's is noted. And you can find that lung fibrosis, you find it is not very uncommon that even a person is beyond 60 years, you find for a small incidence, they have an increased incidence of interstitial pulmonary disease. So this is the whole sum up is seen because of the lack of good sleep. Now, adequate sleep, when we talk about that if there's inadequate sleep contributes to a student overall healthy well-being. Students should get proper amount of sleep at the night to help them to stay focused, improve concentration, and improve academic performance. Now, study has been done by CDC in US, and they found that 6 out of 8 children in the middle school do not get enough sleep. 7 out of 10 in high school do not get enough sleep. And that's why the recommended doses for children is that for 9 hours they must sleep. And for teens it is 8 hours, and for adults it is 7 hours. So sleep has 3 things. Hours, so I think things are very clear. 9 for child, 8 for teens, and 7 for adult. So the hours are important, and the quality of sleep is also important. And thirdly is, you should have consistency in the schedule of night sleep should be there. This is again the same repetition, 9 hours, 8 hours, and 7 hours. Now sleep repairs. We think when we sleep, our brain is resting. No. Brain, and this is the time after library भी library में, by the time the library closes, everything is a chaos. And then the librarian and other staff puts everything in order. So when the next morning the library starts, everything is in place. The similar way, during the sleep, the brain is hyperactive. Whatever information you have gathered during the daytime, it is trying to stack. यहाँ रामायण की श्लोक है, यहाँ गीता के है. This is the way they categorize your thing. So you have learning boxes are there. You can remember, yes, this is Dr. Dipti now had told, this is what I have to recover. And it gives you creativity. Because when so much of input is there of information, then whole night the brain is working to reorganize your things. And in case it is inadequate sleep, then you will say the librarian has been bad. Now, globally there has been a movement going on. Sleep well, be well. If you want to be healthy, you have to sleep well. And again, adults must not forget, it is 7 hours of sleep is important. And do not take, I just now mentioned the sleep is for repair. And where you learn, remember, create. And it is also like kidney works. There's a drainage of toxins. It sorts out everything which is negative. It insists that you should become positive. So it's a big drainage as far as the toxins are concerned. Now whenever there's a sleep deprivation, the sleep deprivation gives rise to many risks, and to sum up, it gives rise to obesity, cardiac disease, and poor mental health. They are also likely to have attention disorders. The children and the teens and behavior problem, and this contributes to poor academic performance in the school. Now, China has brought a law on a digital detox. This has come in July 23. Less than 8 years, it is 30 minutes. Between 8 to 12 years, it is 60 minutes. And out before 18 years, it is 120 minutes. Now, you will say how they are going to regulate. So, they have an affluence and every child has their own phone. So, they have automatically, the system has been built. If 30 minutes are passed, your time is over. Am I clear? So, this is the way they have brought it, and I think China is the first country, and I think many other countries should definitely see to it, because the creativity and mind fogging is seen in children much more because of deprivation of sleep. Now, what's sleep deprivation? What are the common symptoms? You can see daytime sleepiness, fatigue, and when you are irritability on the slightest provocation. You will have trouble thinking, recalling, focusing, remembering. Because night में जो repair का time था, brain को नहीं मिला. Then you have headache, and your reaction are slowed tremendously. These are common symptoms you can feel all around you. As for the severe symptoms are concerned, micro sleeps, कहीं पर भी बैठे सो लिए. Uncontrollable eye movements are noticed. Trouble in speaking clearly is noticed. Drooping of eyelids is noticed. The hand tremors can be there. Visual and tactile hallucinations can be there, and they can be impaired judgment because of the mind fogging. And impulsive behavior. छोटी सी बात में, you can see our whole country is irritable country. They don't have any tolerance. आपकी जगह पे किसी ने पार्किंग कर दी तो ले आया चाकू और मार दिया. This is what is abnormal behavior. Now, insufficient sleep among students. We don't have any study for ours, but the CDC had conducted a study in 2015 nationwide and statewide for youth risk behavior. It showed that the majority of the middle school and high school students reported getting less than recommended amount of sleep for their age. And that's why the experts had advised to the school, whether it is the American Academy of Pediatricians, whether it is American Medical Association, American Academy of Sleep, they said that school should not start earlier than 8:30 a.m. to allow adolescents to get sleep which they need. So in the US schools, by and large, to have a good sleep hygiene, they have decreased the school timings to 8:30 and beyond, and is being followed across the USA, and this will enable adolescents to be healthier and a better academic achievements. Indian schools have to still start this particular program early. In recent years, the evidence from the Western world has accumulated that later school, when it starts for adolescents, it results in students having a better academic performance and they could have enough sleep. I remember when I was in third year, it's a golden jubilee time, Sarvapalli Radhakrishnan had come. And as we have, a lot of grumbling all the time, so he said very simply, make 10 priorities for yourself. The country has to decide what are their priorities. And teach them one-page thing, bold letters in class 1, then in class 2, in class 3, in class 4, in class 10. So by the time the child comes out of the school, those 10 points, he doesn't have to listen from the teachers or from the parents. He knows what the priorities of the country are. So I think, this is the kind of, they feel that this should be part of the curriculum. Once they realize, like diet and exercise, this is one of the basic fundamentals for them to be healthy, then probably they will remember, and there will be less of the abnormal sleep patterns which are found in the student. And in case if you want to develop healthy sleep habits, this should become part of the curriculum. Now, this workshop should be taken when the students read something and then teachers give all inputs and they come to know about more about proper sleep and how to have a good sleep. Now, family and the parent advice is also very important. The child must share and the parents must guide at what time to retire. I think you have seen a couple of your relatives' children outside. They shut them to their rooms by 7:30, 7 o'clock or 8 o'clock. They can't be there in the house. So this is what the pattern is that you have to follow a regular pattern. And I think this is high time that Indian parents also adopt the same. You can't have a different time for parents and for yourself. So I think there has to be adjustment between the child and the parents for a common bedtime. Encourage dim light in the bedrooms. Adolescent youth are exposed to many of the lights, electronic gadgets light, the telephones light, and I think these are the gadgets which should be out from the bedroom to have great sleep. Now, digital detox for all of us is necessary for 2 hours prior to sleep, and the same holds true for children and for adolescents. We find these kind of pictures are not uncommon. For adults who are sleep deprivation is there, they cannot become a team leader. If you want to become a team leader, then you must follow certain things. What healthcare professionals can do? Healthcare professionals have to tell their parents and the adolescent that what is the importance of a good sleep, and also tell them about the digital detox, and they, for good academic activities, insufficient sleep time cannot be tolerated. We all know there's a poor sleep and obesity epidemic. So, obesity brings about obstructive sleep apnea, which is again a sleep disorder. Insomnia is milder one, and obstructive sleep disorders is a result of obesity, which increases blood pressure, increases cardiovascular diseases, increases insulin resistance, diabetes, and other metabolic disorders. Now, there are certain myths are there. Now, what are these myths? People say PM Narendra Modi slept for 3 hours, 4 hours. Indira Gandhi used to sleep for 4 hours. Nehru used to sleep for 4 hours. But don't go with an idea that when you are in an important position or when you are an adult, aapko sleep kam ki zarurat hai. Right? This is wrong. You require a 7 hour sleep, and that should be minimum. एक होता है कि ठीक है आप वीकडेज पे काम कर लीजिए, वीकेंड में हम लोग उसको ज्यादा सो के कंप्लीट कर लेंगे. The study has been done in developed countries, and they found that the weekend catch-up of the sleep does not do any good. This is about minimum sleep. What about more sleep? The people who sleep for 9 hours, 10 hours, it is also not very uncommon in the houses. That also is not good. Both are bad. So that's it. Now, how? One or two more slides. How to impact a good sleep hygiene practices. Now, it is very clear that your getting up time, your sleep time should be fixed. Create a healthy environment for your bedroom. It should be written on your room after 10:30 that is a sleep time. Evening meal should always be light meal. Avoid large fatty meal prior to sleeping. Similar way, exercise is late when you come back from the work should not be done, and limit caffeine and alcohol. Certain people you find in your house don't take any tea or coffee after 3 o'clock, And this is because of the lack of sleep. And definitely schedule your night sleep schedule. So this is again, same tips are there. No exercise, no coffee, no alcohol, detox, no phone time and TV, and don't take big fatty food. So you should have a regular time, just like you brush your teeth before going to sleep, a similar way things should be there. So it's high time we start working on this, first for ourselves and then for the family and the people. These are, you can find, there are many active people are there for the World Sleep Society. Whatever I have said is all there. So before I sleep, say thank you, connect with the Lord, and that's it. Thank you very much. Change your bedtime snack, watch your workout routine. Don't do it in the evening. Use comfortable, inviting bed, great lights, find a comfortable sleep temperature. Setting up, keep the room well ventilated. Block out all distracting noises and eliminate as much as possible. Now there's a possibility of double doors so you don't get any outside noise. And reserve your bed to sleep and sex avoiding is used for work and for general recreation. So that's all about it. I thought, this kind of information definitely brings home that what you should follow and what you should inculcate.